Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's beautiful outside. What an absolutely stunning, gorgeous day. Who can think it's October? But nevertheless, it is, and we are here always for you. We're at 888-630-9625. 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem and you've tried, you've applied, you've done the same old things except more rigidly, right? Well, guess what? You're getting the same results, nothing. So here's an opportunity to figure out what to do without drugs, without surgery. All you need to do is give us a call, and we'll handle that for you. But I have a topic, and we're going to talk a little bit about it because it is a topic that many of us fear. We don't know what to do with. We don't know all the ins and outs and the predictabilities of this thing, something that can drop you dead in your tracks immediately. And to help me talk about that, and what are we talking about? It's cardiovascular disease, and cardiovascular predictability is the queen of my house. So.
Hi.
Hi. Good morning. See, that's what happens.
It's afternoon.
Oh, that's right. You know, that's what happens when I get you up so early and we drive up from Richmond
I know.
after 3 days down there.
See, we
conference.
didn't have to leave quite so early.
I know. I was so afraid of the traffic because it was not good going down.
I hear you.
But we came up early, so we had breakfast. We got a chance to relax a little bit before we came and walk outside. And
walk through Georgetown a little bit.
I know. It was nice.
It was pretty.
It's a very nice day. So we're going to talk about things that drop people dead.
Yeah.
Yeah, it's not a good thing.
What a topic on a day like today.
I know, because we're going to show them how to use a day like today and decrease the risk.
Absolutely.
But nevertheless, there's a tremendous amount of high-risk individuals that are walking around there today.
And don't even know.
And have no clue.
That's right.
And even when they go to their doctors, and the doctors say, oh, your blood work's fine.
Mm-hmm.
Or, on the other hand, oh, your blood work is out of control and you need to take this and that and the other thing,
right.
For the rest of your life.
Right.
But
we're talking standard lipid panels now.
Yes, and what they don't understand is that even those things that they're taking can kill them.
That's true.
And it can kill them with cardiovascular disease.
And they just need to listen to those disclaimers that are rapid fire presented at the end of each commercial to know what some of the side effects can be.
Isn't that great stuff?
I know.
I love it. I mean, it makes you feel guilty that you don't take the drugs.
They say all that stuff and all the things that can happen. Then say, ask your doctor if this is right for you. And I'm going, no.
Not so much.
Not so much.
Not so much. So let's do this. Let's start out this way.
Okay.
Sue, if you had to list the first 3 or 4 or 5 or whatever comes to the top of your head, what are the primary indicators, predictors that somebody may have a coronary problem that is just kind of sleeping there, that all of a sudden is going to jump up and grab them and drop them?
Okay. First of all, the kind of testing that we do makes a big, huge difference in whether or not you identify those individuals or not. Standard panel that they do for cholesterol gives you cholesterol, triglyceride, HDL, LDL, and a ratio. Gives you a hint, but it really doesn't tell you exactly what your risks are for cardiovascular problems.
The medical community goes through the ceiling as soon as your cholesterol level gets above 200. When I was in school, normal cholesterol
was 220.
225.
Yeah.
That's right.
But again, to some degree, yes, it's because they have medication that will lower it, and so they're trying to do that. But also, since that period of time that you were in school, they've done a lot of more studies. They know a lot more about heart disease, and in truth, cholesterol coming down to a lower level may and I say that with a capital M, be a predictor or it may not. And this is what brings me to the next part of that.
But not cholesterol by itself, Sue.
No,
because
it's the testing that we need to take a look at.
I mean, you have people with high cholesterol, and they are totally healthy. They're not plaquing. You do ultrasounds on them. You do scans on them, and there ain't nothing in the arteries,
right.
so to speak.
And if they did the full testing on it, they would understand why that is.
That'd be the point.
Because you have different kinds of good cholesterols, one that's very good and one that's not as good. And you have various kinds of LDLs, or quote, the bad cholesterol, some that are totally harmless and some that are very deadly.
So you can have a moderately elevated according to standards, because now they want you under 100.
Right.
And, they love it when they get you down to 130, except they don't realize that they're increasing your cancer risk, increasing your heart disease risk when you get down that low.
And taking away all the ways you make your hormones.
And your hormones are gone, your brain doesn't work anymore, and life is not good. But they don't get that.
No.
So so let's talk about that. We're talking about cholesterol, HDL, LDLs, HDL being good cholesterols, but they're actually proteins. And they're called lipoprotein factors, A and B, and for the LDLs. And we're talking about low density, big density, small guys, big guys, but basically things that protect you and don't protect you.
Right. There's two primary factors. There's actually 5 different kinds of HDL, but there's only 2 that we really worry about too much. One is HDL2 and one is HDL3. And within the HDL2, there's an HDL2B. There's a test that can be done. It's reasonably priced by some labs. A lot of insurance companies cover it, and it's done through our standard laboratory testing facilities, LabCorp, Quest, they all do it. And what it does is it takes that HDL single number and it breaks it down into which one of the HDLs you have. If you have a lot of the protective HDL2, it really doesn't matter what's going on with the rest of your stuff, because that's going to give you more protection than anything else you can possibly have.
Does your HDL level, though, total have to be high, or can it be just as long as the ratio's okay?
Yeah. The HDL3 is part of that total HDL, and unfortunately when people get, say, a 55, say, on their HDL, and the doctor says, oh, this is fantastic.
Not so.
If most of that 55 is the HDL3, you might as well not even worry about having a 55 HDL, because you're not getting the protection from the HDLs like you should. And the purpose of HDL primarily is to go and gather up the cholesterol in the arteries and remove it from the arteries, taking it back to the liver.
Do you realize that right now this conversation is not only confusing our listeners, but most physicians that are out there?
But it's not new stuff. This test has been around for the last 15 to 20 years. Because I've been aware of it since then.
As we both have. It's been something that we've used in the office with our patients that we take care of.
Right.
And they went, why are you doing all this? My physician of it, because of the things that we're talking about right now.
And on the other side of the coin is LDLs are not bad. They're called the bad cholesterol, but in fact they aren't. There is a form of LDL that is what they call large and buoyant. It's just big fluffy bubbles of cholesterol that aren't going to get into the vessels, are not going to cause inflammation, and basically are the basic ingredients for any steroidal hormone that the body needs. It's also what repairs our cell membranes, our brain, our nervous system. Got to have stuff in the system. Yeah, you've got to have it.
So it's the little guys out there that are beating us up in the LDL, the low-density molecules that are sticking to everything.
It's the little tiny LDLs, or the intermediate density, the middle-sized ones, that are getting in there. They tend to change and go bad, oxidize is what they call it.
They break down the arteries.
And they get in and irritate the arteries and set up plaquing. And those are the ones we want to watch out for. So, again, you could have a high LDL, but if your pattern of LDLs is the large fluffy kind, or the pattern A, they're not causing any damage. It's only when they're LDL type B or the type AB, which is a combo of the smaller LDL and the intermediate size, that you really start having a big trouble. So when you start dividing out your cholesterols and really looking at what you've got, it makes a difference in how your treatment goes. It makes a difference on how nervous you should be about cholesterol, and whether you should be worried about cholesterol or worried about other factors like inflammation.
So homocysteine. We go back to the inflammatory pathway and that little homocysteine bugger that can just kind of destroy an arterial system overnight.
Absolutely, and your brain and your bones. So, I mean, it's not one of the friendly ones. It goes back to do we need to pay attention to what's going on with your blood sugar and your insulin? Insulin is connected to atherosclerotic changes. They're not sure why or how exactly, but they know it is.
Well, the thing with insulin, but also in blood sugar, there's a predictability factor here that nobody really talks about because they don't understand it. Again, there's good blood sugar levels and there are bad blood sugar levels. And if you go to standard laboratories now, they're getting higher and higher and higher. They used to be no more than about 95. And now they snuck up to 100. Now they're up to over 105. And I'm saying, how can you raise blood sugars to 105 standard across the board and call that normal? It's not normal.
No.
And then you look at that with, the standardized testing of A1C hemoglobin, but there's other factors on top of that tell you whether or not all of this blood sugar is causing an inflammatory barrier. And that inflammatory barrier is now what's causing the plaquing. Mm-hmm. So we're back to the same thing.
So we're back to it. And we know that inflammation, from whatever the source is the root cause of practically every single disease that takes us out. And coronary artery disease and heart disease is no different. It's just one other aspect that we have to look at. And there are a number of factors that should be considered when somebody is having a concern about heart health that are often ignored. Because they're not routine, I guess. I don't know what the purpose is.
No, the purpose is this. The reason that you get the standardized testing that we have today is because all of the indicators, all the pressure that's put upon the allopathic community, and we've got a lot of good friends out there that are medical physicians that really care about their patients.
That's right.
But the standard dialogue is not coming from blind research. It's coming from directed, drug company sponsored, funded research. And guess who gets to sell the statins? Yeah, and all the other drugs.
That's right.
And there's nothing there that would indicate or presuppose other than that research.
That's right.
It makes me a little crazy.
It does. Yeah. And the problem with the fact is, if you see somebody that has an elevation in their cholesterol, the first thing that happens is they're told they need to go on statins without even checking to see if, in fact, the statin is appropriate for that person's LDL form or his HDL form. If you're highly protected with lots of HDL2B and you've got large buoyant LDL type pattern A, there's no reason for those people to be on a statin ever, because they're not going to ever have an atherosclerotic plaquing because of cholesterol.
Now, and we're going to get into what happens with the statins as well, because that causes its
own set of problems. But that's where I say, this is possibly one of the explanations of why one person can have low cholesterol and drop over of a heart attack, and another person might have high cholesterol and live to be 100 and never have a flinch in their heart at all. And it's the type and the makeup of the types of cholesterol that makes the difference.
We were talking on the way up to the studio today about ancestry and historical representations of people who've died from cardiovascular accidents. We talked about my mother's father, who at age 70 died of a stroke. Mm-hmm. We talked about my parents, relatively young. My father dropped dead at 68 of a massive heart attack. My mother died young at 75, but of the consequences of pneumonia and then heart failure.
Right.
But both of those people had nothing to do with their ancestry. This had to do with environment.
And
lifestyle. This had to do with the fact that they were smokers. My parents were both hairdressers. They were inhaling fumes all day long.
Sure.
They ate things that, nobody should eat. But then on the other end of the totem pole, he had brothers that lived well into their 80s. He had an aunt that lived to be 100. My mother had other relatives that lived well in excess of
her
their
mother
age
lived into the 80s.
That's right. So we're going to get into that a little bit more specifically. And when we get into the next part of the program, actually into the next half of the program, I want to talk a little bit about what these medications actually end up doing and how the drug companies are causing its own recidivistic action. We need to really understand what it is that we can do for ourselves. But we're here at 888-630-9625, 888-630-9625. Love to talk to you. This afternoon, by the way, I'm going to be at the Pathways Expo at Fairview Park Marriott. My staff is there. They're giving out information. Come on by and say hello. The thing runs till about 6 o'clock this afternoon. Take 2 seconds and shake our hands. We'd love to see you. We'd love to talk to you and answer your questions at the Fairview Park Marriott Hotel, Falls Church, Virginia. Love to see as many of you that we can shake hands with. We'll be right back after this message.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Give us a call, 888-630-9625. That's 888-630-9625. Talking about cardiovascular disease, and with the one person that I know probably knows more about it than most anybody, my boss.
Not quite.
Sue. And by the way, if there's anybody out there that has another view, if you don't believe the data, give us a call. I'm more than happy to discuss it with you. We love to go back and forth.
Absolutely.
Not an issue, and if you can show us where we're wrong, we'll say we're wrong, but I don't think you'll be able to. Give us a call at 888-630-9625. Want to remind you that October is Breast Health Awareness Month, and Thermography Centers of Fairfax is offering you a very special incentive, 20% off on all breast exams. Thermographic imaging shows up the blood supply to the breast tumor anywhere from 5 to 8 years before the mass actually forms. What a wonderful way to be preemptive. Things, if you knew that were happening, that you could do something about. Give our office a call at 703-698-7117, 703-698-7117. And Thermography Centers of Fairfax is located with us. And just say, hey, listen, you want to take advantage. And it has to be done in October. 20% off all thermographic breast scans during the month of October only. Do it today. Give us a call. Sue, let's continue the process here of stirring the apple cart up.
Or whatever.
Something like that. The soup, the gruel, the witch's gruel. Yes.
Well, we talked about the LDL issue and that sort of thing. We also didn't mention about triglycerides, and that is an important aspect because that ultimately ends up in LDLs if we're not careful. And triglyceride to HDL ratio, which is another ratio than what's usually on standard lab work.
Should be 1.5 to 1 or less.
No, it should be a 0.5 triglyceride to 1 HDL. In other words, you should have twice as many HDLs as triglycerides, ideally. If you're a 1-to-1 ratio, you're still doing fantastic. Up to 4 times as many triglycerides to HDLs.
So Dr. Jonathan Wright is wrong?
No, he's not.
Okay.
But at a triglyceride level that's 4 times or higher than the HDL levels, your total HDLs, is indicative of a pre-diabetic potential. It's not a guaranteed diagnosis, but it's saying that your insulin and your body is not managing the kind of fuel that you're putting in other words, the type of foods. Frequently, the things that will create that are your mantra,
Sugar sodas, yes.
Yeah, go ahead.
No, it's okay. It's Sunday. Sugar sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives.
Absolutely.
That's right.
Most particularly in that category, your refined flour products, your sugars, alcohol, and trans fats, hydrogenated and partially hydrogenated fats are the biggest culprits.
Inflammatory pathway problems of any sort, and predictably because of somebody's allergic or sensitivity reaction to any food whatsoever. I mean, if you know for a fact that you're eating something and after you eat you're plugged up, or if you don't feel good, or your stomach bloats, or you ache a little bit, or you got a headache, that's called a sign.
Sure.
And it's called you're increasing your risk both of inflammatory pathways of all kinds of problems, but particularly with cardiovascular disease.
Mm-hmm, mm-hmm. But when those triglycerides go up, that's telling you you're not managing your fuel very well. And there's a lot of things that we can do, and we'll talk about things like that later on.
So I got a question. All right. So somebody has really low triglycerides.
Mm-hmm.
They have moderately okay HDLs.
Mm-hmm.
Their LDLs are not in a good place, and their cholesterol level is jacked up.
Mm-hmm.
What's causing it?
Stress, lack of exercise,
pain.
Lousy diet,
pain patterns,
chronic pain patterns, the usual things that are taking most of our high-powered people in this country out.
Yeah, people put up with, and then they take all kinds of medications that actually rebound it and make it worse.
That's right. And it's not just the heart disease, not to get off on a tangent, but it also is a preliminary to diabetes, to the cancers, and to all the other things that are taking us out, the top 5 things that kill us in this country.
They're all tied
including the misapplication and use of medications to deal with those things.
You know, yesterday we were at a conference in Richmond at the Virginia Chiropractic Association annual convention, and there was a guy by the name of Dr. Dan Murphy from out in California, one of the most brilliant people that I just love to listen to this guy. And he was talking about what we're talking about right now with all the inflammatory pieces of the puzzle as it relates to chronic pain, and he was tying them all in.
Right.
And you're sitting there and you're looking at things that we know that are causing these people to die.
Yeah.
And he says they are a significant predictor of destruction.
Absolutely, they are. And that goes back to the fact diet and lifestyle is the biggest factor in either having a problem with a degenerative disorder or getting over one. That's bottom line. That's been proven time and time and time and time again in all of the peer review sanctioned style of research.
So everybody's got to eat like me.
Diet and lifestyle.
Like
or whatever.
We're at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're playing with cardiovascular disease and the predictabilities and the things, and we're going to get into some of the things that you can do to help yourself along the way. Don't go away. We'll be right back after some very important information and the news.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-9625. Love to talk to you. Give us a call. Let's answer your questions. We're talking about cardiovascular disease, but nevertheless, you're the important one. I want to remind you of 2 things. One, after the program, we're going to scoot down to the Fairview Park Marriott Hotel in Falls Church, Virginia, to kind of check out the Pathways Expo. I'd love to see you. My staff is down there. We got an information booth. Come on by, say hi, and I'd love to shake as many hands as we can. I'll be there probably from about 2:00 or so on to about 6. So come on by, say hey, and tell me that you listen to the program. Pathways Expo, Fairview Park Marriott Hotel in Falls Church, Virginia. Also, want to remind you that October is Breast Health Awareness Month, and the Thermography Centers of Fairfax is offering a 20% discount on all breast thermographic examinations. All you have to do to take advantage of that is give our office a call, actually. It's 703-698-7117, 703-698-7117. Tell my staff that you'd like to take advantage of breast health awareness. Just remember, ladies, that that blood supply begins to form well in advance of that tumor, of that cancer. And if you know that it's happening, there's so much that you can do from a preventive point of view to turn it around before it gets a hold of you. It's an important situation. And by the way, I want to encourage you, go to our web store at rosellecare.com and check it out, because we've got some new items in there. We've got a toothpaste that actually has none of the junk in it. It has xylitol, which will help bacterial infection. And we have a gum that also has xylitol and doesn't have the rest of the junk in it. And, when you chew to refreshen your mouth after you eat, and by the way, in my opinion, that's the only time you should be chewing, you can do it safely with this stuff. So check it out, rosellecare.com. Go to our web store and see what that's all about. Meanwhile, Sue, let's talk about one of the predictors that we haven't talked about yet.
Okay, you just mentioned part of it.
I know, infection.
You know that xylitol,
Yes,
gum,
yes.
and toothpaste.
Yes.
Okay. One of the things that can create cardiovascular disorders, primarily the inflammation or the elevated high sensitivity CRP reading that people get, is periodontal disease.
See how good I am at segues?
I know.
I mean, one right into the next one, right?
And we'll just throw in there at the same time the H. pylori, which is the bacteria that eats a hole in your stomach and causes about 85% of the ulcers that people get.
And so many people have high levels of H. pylori and don't even know.
And they don't even know
They
it.
have no clue.
Well, until somebody has a hole eaten through the stomach.
Yes. And then it's a problem.
and
That's called an issue.
But anyway, inflammation is another factor that is, it's not part of the cholesterol picture, but it's reflected in the cholesterol, in the patterns of the types of cholesterols that you have. The higher the inflammation, the more likely it is that you're going to have oxidized cholesterols, the IDL and the LDL. That's the more dangerous version of it, not the pattern A, but the pattern B. And periodontal disease is directly related to cardiovascular problems. In fact, that's why they used to do antibiotics all the time for dental work, because if you release bacteria from the mouth, it automatically went into the valves of the heart.
But
and
that got out
caused
of
troubles.
hand, too. They started doing it prophylactically and then knocking out immune structures, and then you got another problem.
Then they found that really wasn't the case. So
you have a Pandora's box here. Here's an interesting situation. One of the other primary predictors of cardiovascular disease is chronic pain.
Right.
And because that sets up the inflammatory. People live with pain. They don't want to do anything about it. They should come and see us because we can fix it, and they don't have to deal with it, but they put up with pain. So how does that, here's the double-edged sword, right? So they go to their docs, or they just decide to do it on their own, and they go to the store and they take all kinds of NSAIDs, non-steroidal anti-inflammatories, okay, which is the same components that Celebrex and so forth are made out of, right? Well, you take these NSAIDs, these non-steroidal anti-inflammatories, the aspirins, the Motrins, the Advils, and, we can hit them all, Aleve, and they have a nasty, nasty side effect. Mm-hmm. It depletes coenzyme Q10, it screws up the mitochondria, and the side effect is cardiac failure.
And depletes folic acid, which is a key player in keeping another one of the inflammatory markers at bay called homocysteine.
Yeah.
And you get into it, and this is not a simplistic, we're making it sound maybe a little bit simplistic, and it's not. It's very, very complicated. But there are so many factors involved with heart disease that...
Well, Sue, it's simplistic only from the point of view that all of these things that we're talking about, all these markers, are highly controllable and reversible.
They are.
It's not something that you have to live with, except in our society we get a pig-headed state of existence that says, I don't want to change anything.
Well, and it's harder to make lifestyle changes than it is to pop a pill.
True. They want somebody else to do it for them.
That's right.
Not do it for yourself. Health is a do-it-yourself program. I think somebody wrote a book by that name.
Yeah.
Yeah, never mind.
Yeah. He's published, I think.
I think so.
But the point is, there are so many things that can be done long before people have to start using medications. And they actually change so many of these markers that lead us to heart disease, lead us to the inflammatory markers, get the homocysteine elevated and so forth. Natural things that don't have side effects and don't have disclaimers at the end of the commercials. They're also not promoted by the commercials because they're natural things. But dietary patterns that change, and not even radically. I mean, one of the biggest things you can do from a natural standpoint to alter not only the structure and the form of the LDLs and the HDLs is simply get rid of the trans fats, the hydrogenated and partially hydrogenated fats. And a lot of people are really good about eliminating those from products that they look at with a label, but then they go to McDonald's or other fast food places and they have fried foods. Huge source of trans fatty food.
It's not only the trans fat, it's the bacteria. You go to McDonald's, right? Or any of the other, you go to Burger King. Let's not leave any of them out.
No.
Because they serve, the hamburgers and so forth. They're allowed so many parts of fecal matter.
Okay, now you're getting on a tangent.
All right. No, but the point of it is that's E. coli.
Yeah,
that's an infection.
Yeah.
That gets in your system and stays there. And
it
all of a sudden you see these mutant level. You think? You think it's really, Sue? I don't mind taking pot shots at people when they're right. It just happens to be that way.
But the point is, just by making one single change like that can make a difference in increasing your level of protective HDLs, decreasing the proteins that form the LDLs, particularly the smaller pattern B LDLs, that will decrease your triglycerides, and another one of the cholesterols called VLDLs, decreases the risk for blood clots, decreases heart attack potential, particularly the irregular heartbeat or the afibrillation and sudden death syndrome, where you just suddenly drop over with a heart attack.
There's so many minor things that people can do to shift all of this nonsense, little things, step by step.
That's one thing. That's just one thing.
I know. And if you get into a situation where you say, hey, why don't you go out and take a walk every day? Just walk 2 miles, and we don't care how fast you do it. Just walk 2 miles. Put a headset on. Go listen to something. Decreases your risk of dying from any disease process, not only cardiovascular disease, by 50%.
Right.
Get rid of the sugars. The sugars clot your arteries. Have you ever taken a cup of sugar, put in a saucepan under low heat, and just let it begin to melt? It turns into this hard caramel stuff. That's what it does in your bloodstream. It plaques your blood. But people don't get that. They say, I got to have my sweets, I got to have my stuff.
You can drink green tea.
Like I do.
Yes.
Yes.
Green tea is another one.
Can I pat myself on the back some more?
Absolutely.
Okay, thanks.
Hugely powerful. It
really is. It's amazingly powerful.
Decreases the ability of the bad or the LDL cholesterols, the small and the intermediate-sized LDLs, from changing into that toxic form, that oxidized form. Drinking 2 or 3 cups a day. It decreases.
Strong, by the way, strong green tea.
Well, it doesn't have to be strong.
It has to be at least 8 to 10 minute brewing time, Sue.
Okay. It decreases one of the proteins that forms the LDLs in the first place, and it actually raises the good protective HDL2B. That's just drinking green tea, a couple cups a day.
And giving up the coffee. Even though all the stuff out there is saying that coffee is so wonderful and so good for you, there are people that can't tolerate it because it messes up the liver and it causes a backup in phase 1, and now you got all this debris circulating around your blood and your lymphatic system, triggering high inflammatory levels. And by the way, that's why coffee is not good for you.
Now you're on a tangent again.
Yes.
Okay. We're talking simple things that people could do that actually change the structure, actually change the genetic potential in some cases.
So if I didn't irritate people, it wouldn't be me.
Trans fats, getting rid of those, and drinking 2 or 3 cups of strong green tea a day. Taking omega-3 fats. If you don't like to eat fish, do the fish oils.
There's some good products.
You can get some excellent fish
oils. Go to places like Whole Foods or Mom's or Trader Joe's and ask them for good, clean sources, because so much of the junk that's out there is farm-raised, and they're putting into fish oils.
I know.
So you got to be careful where it's coming from.
Be careful where it comes from.
Because if you're getting farm-raised anything, don't eat farm-raised salmon, don't eat farm-raised fish of any kind. Get it wild-caught, cold waters only, because of all the risk of the pollutions, but also the mercuric oxide toxins and the like. And we can go into that subject and spend two days on it.
You're on a tangent.
I am. But nevertheless, they have to do that.
And if they do, find the good omega-3s.
That's
and
right.
they eat the wild-caught,
But
cold-water fish.
3 grams a day.
About 3 grams.
Minimum.
That will increase their protective HDL2 and lower the number of LDL particles as well as increasing the particle size of the LDL. So remember, you want the large, fluffy LDL, not the small or the intermediate size.
Now, there is a problem with taking any fish oil and any oil itself. They oxidize quite quickly.
That's right. So you add a little vitamin E in the mix.
A little less, and you'll be in good shape.
And that goes along with the antioxidants.
And keep them in the refrigerator.
So if they take fish oils, stay away from trans fats, drink some green tea, and go for a walk, they can do a huge amount of things just in that little bit to alter their pattern of risk from a standpoint of cholesterol as well as inflammatory markers.
Flush your teeth. Brush your teeth at night with xylitol toothpaste.
There you go.
And make sure you clean it up after every meal. Stay away from the sugars. Don't let it rot in your mouth.
That's right.
That's right. Because
keep your blood sugars balanced. So there's a lot of, the point is, there's so many different things that can be done from an alternative, if you want to call it that, just a lifestyle, simple lifestyle change. This is not radical. This is not throwing the baby out with the bathwater. This is just making some small alterations.
No, the truth of it is that very, very simple steps can increase tremendous amount of longevity and morbidity to your life. It gets rid of the destructive process.
That's
your
right.
energy goes up. You have a feeling of life's worth living again.
Right. And, we talked about using exercise. Everybody knows exercise is good for us, but what a lot of people don't realize is genetically you have the potential of turning off the get sick genes and turning on the get well genes through the proper types of exercise. And that is not going in and join, gym and 7 days a week, 3 hours a day.
No, and it's not going out and running all the time either, because that can have a deadly effect on your system.
That can have a reverse effect.
That's right. The inflammatory levels can get stoked
Right.
up. It has to be done in balance. It has to be done based on your cardiovascular system and genetic background. And we're talking about an area now that we're just touching upon. It's called epigenetics, and all these dormant DNA genes hanging around. You can stimulate them to be turned on. You can stimulate them to be quiet and turn off.
That's right. But the thing here is what you do after you've done the exercise, and we'll talk about that
When we come back?
in the next section.
Oh, okay, because we'll have a few minutes to close it all off and,
That's right.
To talk about all this. But in the meantime, this is, people are dying, in our opinion, needlessly.
They are.
It's it's on the hit parade worldwide of, the number 2 or 3 things that takes us out early. Not necessarily.
Well, I think it's still the number one killer of people in this country.
It is in this country, but I'm talking about worldwide disease.
Yeah.
And it can be blocked, it can be handled, it can be dealt with in a much more prudent, much more effective way without the drugs. People are locked in. The drug industry is producing billions and billions of dollars instead of educating people how to take care of themselves.
Mm-hmm.
I mean, it makes me crazy. It makes me nuts.
Cardiovascular disease does not take out third world country people.
No, they don't even have it.
They don't even have it.
It doesn't exist.
No.
That and back pain, by the way.
That's right.
Which is a very, very interesting subject that we should cover in another program. We'll be right back after some important messages. Don't go away. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
We're back and still stirring the pot. This is Dr. Tom Roselle. We're here at 888-630-9625 every Sunday at 12 noon, bringing the most intimate information in integrative and alternative therapies. Love to talk to you either on the air or on the Internet. All you got to do is call us here or get a hold of us at rosellecare.com. That's ROSELLECARE.com. Send me a note. I'll get back to you, I promise. Sometimes I'm a little sluggish depending on my travel schedule, but I always answer some things quicker. If you need an immediate answer to a question, the best way to do it is call our office at 703-698-7117. And by the way, when you're on our website, it's set up for an interactive learning process. There's a spot that says drtomroselle.com, and if you hit that tab, it'll take you into another website that we use for webinars and videos and so forth, and answer your questions and blogging and so forth. You'll enjoy it. Trust me, you'll enjoy it. Go there, start out with rosellecare.com, and give us a call. And ladies, don't forget, Breast Health Awareness Month. Call our office and schedule an appointment today. Sue, let's wrap this up a little bit.
Okay.
So, you had a commentary.
Well, you were saying that just doing high-intensity aerobic activity all the time isn't good, and it's not. You really need to cross-train. You need to do strength training, you need to do core training, you need to do cardiovascular aerobic training. So when you're doing multiple days of exercise, you don't go out and run every single day 20 miles or 15 miles or 10 miles or whatever, because you're using the same muscles over and over and over again. You're getting into overuse patterns, and you don't get the benefits for the cardiovascular system because your body gets used to it.
And you're also eating up all the things that facilitate mitochondrial function, which is the energy pack within the muscle, and that can lead to something we talked about earlier called heart failure.
Heart failure, that's right. And so can statins, so that's that's the problems we got
so
there.
The statins and doing too much cardiovascular is both a problem. Everything's got to be
And people have probably
perspective.
seen the articles out there that saying, too much cardiovascular training is not good for the heart. And that's what they're talking about. You overdo some exercise and you wear out part of the body without balancing it out. And again, we're back to the same thing. It's all a balance.
I have some really intense guys that come into the office and they work these 12, 15-hour days, and then they go out and they're going to start running.
Yeah.
I say, are you crazy? Go home, put your feet up, listen to some music, do some yoga, do some tai chi, and relax a little bit.
Right. But so strength training comes into play. All right. And different exercises operate differently in the body as far as their effects. Some of them support the cardiovascular system in relaxing the muscles of the arteries so the blood pressure goes down, and strengthens the heart muscle. But again, you don't want to overdo because you don't want to enlarge the heart as well. Strength training actually encourages the development of the mitochondria that was just you were talking about a minute ago, the energy packs within the cells themselves, which you don't get when you do cardiovascular aerobic training. All forms of exercise, however, have the downside of creating oxidative stress and free radical damage. And so what you eat afterwards makes a huge difference, and that's your high antioxidant foods, your bright-colored vegetables and fruits, and good proteins.
Sue, if we haven't stirred it up today, we never will. We'll see everybody next week, same time, same old place. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give